May is Skin Cancer Awareness Month, a good reminder to slow down and pay attention to changes in your skin. Loving Living Local's Kenny Johnson speaks with Dr. Victoria Moss of Aria Dermatology and Aesthetics about the early warning signs of skin cancer and what to watch out for. Take a look.
All right, once again, we are back at Aria Dermatology with our favorite, Dr. Victoria Moss. Thanks for joining us this morning.
Thank you for having me.
All right, we have something important to talk about. The month of May is Skin Cancer Awareness Month.
Yes.
It's super important, isn't it?
It is. So May is not only Skin Cancer Awareness Month, but it's also Melanoma Awareness Month.
Oh, okay.
And it's super important because it just gets the word out that you really should be getting your skin checked. Skin cancer is the #1 type of cancer that we see in the U.S. population.
So once May hits, then it gets into our brains that we need to be checking, right?
Absolutely.
Because getting skin cancer checks is super important.
Exactly.
Which signs are people maybe missing?
Yeah, so the big thing is there's a lot of different ways and things that we see with skin cancer, and it isn't always very obvious. So the things that I like to tell my patients, #1, if a spot is just not wanting to heal, it kind of is behaving like a pimple, but it doesn't want to heal. If there's an area that just is continuously bleeding, if there are spots that are changing, or if it just looks different from the rest of the spots that you have on your body, it's probably time to get checked.
Yeah, putting you on the spot a little bit here.
Yeah.
When it comes to moles, moles are another thing that we should be looking out for, right?
Yes, absolutely. So moles are actually super common, but if you have 50 or more moles, it does increase your chance of developing skin cancer, and particularly melanoma, which is why it's super important. We look at several different criteria, especially when it comes to moles. So we look at the A, B, C, D, and E's. So A means asymmetry. So if something is cut in half, one half does not look like the other. B is borders, so if you have irregular borders. C, color, so if you have more than one color or a really dark black color, that is something that we want to see and look at. D is diameter, which is greater than the size of a pencil eraser. Personally, it's my least favorite criteria that we look at. And then E is evolving. So if it's changing, if it was previously flat and it's become elevated, or if it's looking different from what it was 3 months ago, we want to take a look at it.
All right, since it's May and people are, getting back into the swing of things with getting their skin checked, what's the easiest way that they can do that here at Aria?
You can give us a call at 719-377-3727.
Sweet. All right. Thank you so much, Dr. Moss.
Yeah.
We're going to check in on some other things that they got going on right here on Loving Living Local.
Thank you so much. This segment has been brought to us by Aria Dermatology and Aesthetics.